First up, though, let's talk about, I mean, this is absolutely mind-blowing. Whitehall civil servants took off a total of, wait for it, 2,100 man-years of stress-related sick days last year. Not only do they work from home when they're not on strike and have an awful lot of long COVID, goodness me, in the public sector, long COVID is absolutely rife. Whitehall's civil servants amazingly managed to take off for stress and other mental health problems more time than ever before. A total of 771,433 days of mental health sick leave between them. That's a rise of 38% on the year before. All, by the way, funded by you and me. Let's talk to Elliot Keck, who's Investigations Campaigns Manager at the Taxpayers Alliance. Good morning to you.
Morning, Julia.
These figures absolutely extraordinary, aren't they? And there's no doubt at all that we see in public sector versus private sector, the number of sick days lost, the number of people who've suffering from long COVID and anything that cannot be, shall we say, independently verified. Like, oh, your leg's fallen off, you know. I'm joking, but really, literally, we see this. The rates in the public sector are sky high compared to the private sector.
Well, Jacob Rees-Mogg raised the concern that this mental health crisis may just be becoming the new bad back. And it's really interesting research from the Labour Party that echoes stuff that the Taxpayers Alliance has done before. But the Labour Party places the blame firmly at the doors of ministers for causing these mental health crises. Now, I'm not sure that's going to gain much traction with your viewers who know that if there's one thing that the civil service will spend money on, it's huge human resource departments. Yeah. And yet still we have these very significant problems with things like mental health. Well, that's it. I mean, again, I've got a very good friend who works in dealing with people in the benefits office on the front line, on the counter, and again, you saw over the years it went from people having back problems. Again, I've had back problems in the past. You know, you've got sedentary jobs. You know, you can if you say you've got a back problem, you've got a back problem. It's very difficult for anyone to verify whether you do or you don't. And then it became stress. Now it's long COVID. And other mental health problems. And the reality is, with both long COVID and mental health problems, I mean, it's what you say. I mean, you know, no one can tell you don't have a mental health problem or you're not suffering from stress or anxiety or depression, whatever it is, because it's entirely, you know, it's your perception, isn't it? But the awful truth about this is, you know, there are people who are suffering genuinely from all of these things, and they are very, very debilitating and very distressing for people and have a massive impact on their lives. And it makes, I think, a lot of people, including me, very angry that we know there'll be people who are swinging the lead and who are using these things and taking advantage of people's genuine problems, claiming, yeah, I've got long COVID, oh yeah, I've got stress, to basically to bunk off work. Yeah, I think you're absolutely right, and of course the problem is the people that do genuinely need the help that they deserve are not getting the help that they deserve because it's so difficult to work out who the people with the serious problems are. But clearly there is a problem in the civil service with the culture. We've done research before showing that tens of thousands of days have been lost where civil servants have taken days off without a sick note, despite the fact that a sick note should have been required. We've found that the £55 million could be saved if civil service sick days were brought in line with private sector sick days. And listen, the civil service, there is a culture that should reduce these problems. They're allowed to work from home at a far greater rate. They're given a lot more
I'm not sure that helps people, but there we are. But
well, possibly. But I mean, we talk about all these different things that may help people's mental health. They get far more annual leave than most people in the private sector. And clearly there is a cultural problem that is leading to these far inflated rates in the public sector. And it
is a really big issue. Look, I was freelance for many years. You know, it's amazing how few sick days people who are freelance take. I mean, I don't think didn't take a single sick day in 7 years. I mean, I just, you know, you have to be healthy. And you go when you're feeling unwell. People are like, oh, well, you shouldn't go when you've got a cold. Oh, great, I just won't get paid and won't pay the mortgage if I've got a cold. That's a nonsense. And millions of people live like that. People who run their own businesses, people who are freelance, or people in perhaps an uncertain work, or people who just frankly want to do a good job for their company or the business and keep it going and don't want to let down customers and the like. Whereas there does seem to be an attitude of, I just don't feel very well, I won't go in, from a lot of public servants. And this is giving public service a really bad name. I think we used to think of people who were public servants, we use that term, public servant to the public, that this was honourable work and these were people doing important work. We are now much more sceptical and frankly quite, and a lot of us, and I'm definitely among those, really quite sort of, you know, rude about people in the public sector, especially any job that isn't like a frontline job, whether it's someone, if you're working in a fire service, you're a doctor on the front line, people feel very warm towards those people doing a job we can see. But people are now sort of thinking, these people are just taking the mick out of us. They're not providing a good service. You can't get anyone on the phone at the council. You know, all the people collecting your bins. You can't get a passport. You can't get a driving test. All these organisations that are supposed to be running services for us just aren't doing a very good job. And is it because, frankly, half of them are not at work most of the time?
I think what we need is far more rigorous standards within the civil service so that when people are genuinely off on mental health, we know these are people with genuine issues that need help and hopefully are getting the help that they deserve. But until we have that far stricter line, you know, requiring a sick note if you take more than 7 days off, you know, maybe asking people to come into the office more if they're having some mental health problems, if that will help. Until we have that more rigorous line with people and with civil servants and with public sector workers, there will always be this air of uncertainty about whether or not the people that are taking time off work are simply just skiving off on the taxpayers' dime.
Absolutely. Elliot Keck from the Taxpayers Alliance, thank you very much indeed. It's coming up to 9:38. Let's